I'll yield.
Thank you. I want to make sure, because you've repeated several times, other members on that side have repeated several times that this bill is intended to ensure that no one loses coverage, vulnerable people who Medicaid was originally intended for. And that caught my attention. And so I just want to ask point blank. The Affordable Care Act expanded who was eligible by allowing the states to cover adults with incomes up to 138% of the federal poverty line, which for an individual in 2025 is someone who makes up to $21,597 a year, which to me is someone who's pretty vulnerable. So will this bill ensure that individuals who make up to 138% of the federal poverty line, who were included in Medicaid expansion in the states that expanded it, who meet the requirements, will not lose any coverage? Is that the intent of this bill? Are they included in the vulnerable population that Medicaid was originally intended to cover, as stated by you, Mr. Chairman?
If they are eligible, they are going to continue to be covered. What we are looking to do is to remove those who are registered in more than one state. What we're looking to do is to make sure, and yes, there are those who are eligible in more than one state, and we're going to clean that up. We're also going to make sure that if they're not supposed to be on the Medicaid rolls, that they're not on the Medicaid rolls. Therefore, we're going to take care of those who are the most vulnerable, who should be getting this most necessary coverage.
And Mr. Chairman, just to be crystal clear, because it's 1 a.m. and very few people are paying attention to this, and I want it very clearly on the record. The majority party that wrote and intends to vote for this bill includes the expansion population in those states that expanded it to cover adults who make up to 138% of the federal poverty line. You include that as the vulnerable Americans who are eligible and should continue to get Medicaid.
The bill before us includes a work requirement so that if they engage in 80 hours a month and the parameters are set, there is no reason why they would not be able to continue on this Medicaid.
And Mr. Chairman, who will implement the work requirement?
Work requirements are in this bill, the parameters of that, and they will be administered by the states.
Okay. So that includes Georgia, which when it implemented work requirements, kicked eligible people off the rolls. That includes Alabama. This is not a question, this is a statement. That includes Alabama, that when they implemented work requirements, that kicked people off of the rolls who were otherwise eligible. That means if you fill out the paperwork incorrectly, you lose your health insurance. That means if the state hasn't figured out how to determine when you got pregnant, when you stopped or began work, you're kicked off. That means that under this bill, because they do multiple checks, if you've been laid off and you haven't gotten a new job yet, you're kicked off. That's what that means. And we're going to have a whole lot of discussion about work requirements tonight, because basically the work requirements are red tape requirements that if you fail to fill out these forms that states, there's evidence that states have not been able to implement in a way that doesn't kick off eligible people. We're going to have a lot of conversation about that this morning. I yield back.
What is the argument for adding an additional cost for folks going to see a doctor? If that money was being invested back into Medicaid, you could make that argument, but it's not being invested back in Medicaid. You're using it for the tax cuts. So what's the argument for requiring people to pay more to go see the doctor?
Does the gentleman have a question? That's pretty a long question.
No, that's literally the question. That's the question. What is the argument?
Again, what we're doing here is that we are making sure that we're going to sustain this program. We're going to stabilize this program. You know, I don't buy into the idea that just because you're cutting a certain amount of money, that means you've got to cut
No, I just want to reclaim my time. It's a question. You want to sustain the program. I get it. I get that's what you're saying. Why are you charging people more money to go see the doctor then? That is the question. What is the argument for that?
Part of what we are proposing is to make sure that this program is sustainable.
But you're not investing the additional money. You're saying to people, low-income folks, people who make $16,000, $17,000, $18,000 a year, you now have to pay more to go see the doctor. But that money, that new revenue is going to pay for tax cuts. It's not going to Medicaid. So how is that helping people on Medicaid?
Again, what we're trying to do is make sure this program is sustainable. I think it's presumptuous for you to say that money's not going back into the program. The money is going back into the program to make sure we sustain it, to make sure we stabilize it, to make sure that it's there for the most vulnerable in our society.
I mean, you can't say lie. We're not saying lie, but we know it's not. You're using that money to as part of the $715 billion that's being removed from Medicaid in order to pay for the tax cuts. So it's not helping anyone on Medicaid. The shifts to the states, where the states are going to have to pay more, we're going to pay less. A lot of states won't be able to pay their part. People will lose coverage. How is that helping to sustain Medicaid? How is that helping to protect Medicaid?
Whenever we clean up the rolls, whenever we take people who are not supposed to be on there, when we put illegals off of here, when we get people who are in more than one state, that makes more money for those who need it the most.
But you're not, first of all, you're taking health care away from 7-8 million people. Cleaning up the rolls is going to be heartbreaking for people who are about to lose their health care, that they lost their health care as part of an effort to clean up the rolls.
If they're not eligible for it, they shouldn't be on it in the first place.
But they are eligible.
No. That's not who we're going to take off the roll. If they're eligible, they will be on the roll. What we're going to do is to take those who are not eligible, who may be in more than one state, and we're going to make sure they're only in one state.
Wait, what?
What?
I'm sorry, this is confusing. This is why I'm going to yield back because I'm out of time.
The gentleman's time has expired.
You have created enormous confusion on top of the real fear.
The gentleman's time has expired. Does anyone else seek time to speak on the...
Continuing on the theme of corporate profiteering that we have going on here, I want to address some of the very concerning cuts and gutting of nursing home safety provisions in order to pay for these further tax cuts. Because across the country, for-profit and private equity-owned nursing homes are operating with skeleton crews and dramatically reducing quality of care for people who are in nursing homes in order to, again, pocket the difference. Staff in nursing homes often have to care for 30 residents at a time on their own. And it's not because nursing homes don't have the money. Nursing homes receive tens of billions of taxpayer dollars each year, and instead of investing in higher worker pay and better care, they often take that money and pocket the difference. There are cases of nursing home residents laying soiled in their beds for hours, being drugged or physically restrained, and suffering from pressure sores and falls because there are not enough staff to care for them. Many of these nursing homes just pay workers poverty wages, and they subject them to dangerous working conditions. Now, the nursing home industry will tell you that requiring a minimum number of nurses is too costly and that it's too burdensome. But what they are not telling you is how nursing homes funnel billions of dollars meant for patient care through other companies that they own. They are funneling right now $11 billion annually, to be exact. And they do this to make it look like they are less profitable than they really are, so that they can tell legislators like us that they don't have the money to hire more staff or pay them more or provide better care. And there doesn't appear to be much federal scrutiny over this. This amendment asks that the rule around safe staffing ratios be reinstated in any state for which there is an occurrence of an adverse event, including death or a temporary harm event that is due to inadequate staffing levels that would not have been permitted under the nursing home staffing rule. And with that, I yield back.
Gentlelady